Hi, I'm Dan Gardner with a brief introduction to my traumatic brain injury literature search page.
Traumatic brain injury recovery. Please like, subscribe, and comment on this video.
I've compiled the TBI searches below in categories of type of TBI, diagnosis, prognosis, symptoms, problems, treatment, specialties, and more. So let's scroll down the page and take a look at the layout. Diagnosis, treatment, mild TBI, blast TBI, by symptoms and problems like aggression, coma, fatigue, and by specialty and treatment, acupuncture, life care planning, ophthalmology, physical medicine and rehab, psychotropic medication, products and services, and traumatic brain injury databases. So let's take a look at TBI diagnosis review articles, see what kind of results we get. These are sorted by publication date. And let's look at this article, Non-Invasive Diagnosis and Treatment Strategies for Traumatic Brain Injury and Update. If we want to see more than the abstract, we can get the full text here. Sometimes it's available free. Most of the time one has to pay for the full text of the article. Now let's look at some results for the consumer TBI treatment. And we're using Medline Plus, which is a trusted source, and you can see that there are many results, and we can scroll down and see which ones are most relevant for you. If you'd like to do your own PubMed searches, you can click here to learn how, or you can automated searches on the topic of your choice at a free site by clicking here. Now, if you find this page valuable, I hope you'd consider donating to these two organizations, San Diego Brain Injury Foundation and Southern Caregiver Resource Center. And if you'd like to see additional search terms, features, or services on this page, please contact me by email by clicking on this link. So I hope you found the tour helpful and that the page will be valuable in your search for TBI literature, and enjoy your searching.
I hope you liked this video, and please let me know in the comments what questions you have and what other topics you'd like me to discuss.